Hi, Danielle. Thank you for taking a little bit of time out of your now super busy day to talk to us. Where does this conversation find you? Where you're looks like you might be at home.
I'm at home,
Yeah. Okay. And where's home?
Upper Michigan.
Oh, nice. Is
Right.
getting cold up there now?
Fall's starting to kick in, summer's winding down.
Yeah. Yeah. Same here as well, though we had this crazy heat wave the other day. Um, but anyway, I know you got a lot going on in your life, which is really wonderful. One of the things I like to see, especially at this point after an operation. But we first met actually back in April of 2021, kind of the middle of right in the heart of the COVID thing. You eventually came out to see me, but tell me a little bit about what was happening with you with regard to your headaches at that time.
Um, at that point, I was not functioning.
Mhm.
I was basically bedridden. Had to give up my job. I couldn't really partake in any activities. I couldn't drive. I couldn't ride in a car. I was pretty uncomfortable and miserable, to be honest.
Yeah. Yeah. And had you tried a bunch of things to like you've been to a lot of doctors over the years and tried a lot
I
of
tried,
medicines. Yeah.
yeah,
Tell me a little bit
I
about that.
tried physical therapy. I did nerve blocks. I tried a couple medications. Um, Nothing was really working for me.
Okay. And so, kind of long story short, we first spoke virtually, I believe it was, and then eventually you came out to see me. And based upon your symptoms, we determined, and the results of the blocks and physical examination, we determined there was a number of nerves in the back of your head that were causing the
Mhm.
problem, which we operated on in May of 2021. Um, Talk to me a little bit about what the operative and perioperative period was like. Did you have a lot of pain, nausea, vomiting? Yeah.
I did not have any nausea or vomiting. I actually did not even require the painkillers. I was pretty numb for the first month or two. Months 3 and 4 were a little more challenging as the nerves started to wake up. Um, some nerve blocks helped me get over that and get through that. Around 5 or 6 months post-op, 5 months post-op, was able to return to work. And by 6, 7 months, I was able to return to normal activity and resume running and
Yeah.
living a normal life again.
Yeah. So you're now almost 18 months following the operation. Um, Talk to me about how life is different. So what is work?
Um, I work as a cashier right now at a home improvement store.
Mhm.
I'm more physically active than I've ever been. Now that I have a new lease on life, I'm not taking it for granted. And I've been
That's
able to
great.
bike, 30, 40 miles and running, 5, 6 miles and working
Yeah.
out, getting stronger.
You look a lot fitter than when I first saw you. I think we were discussing this at one point. Your post-operative course, you were pretty thin when I first met you, and not in like the healthiest of
Yeah.
ways. So you're very glad to have put on a little bit
Yeah.
of, it looks like, some muscle weight. And I keep telling you should try to be a triathlete because you're already doing the running, which I hate the most. It's the worst thing for me. I grew up as a swimmer. You're already doing the cycling. You just got to get in the pool a little while, and then next thing you know, you'll be doing Ironman. So,
I do
um,
want to do them over the winter. So
okay, well there you go.
and my
Now you
appetite
also
went up right
have.
away.
Sorry, go ahead.
Oh, my appetite went up right away after surgery, and I was able to, start getting healthier.
That's great. Now, one other question I always ask people in terms of like their relationships with, just the outside world, which you've already sort of touched on. But when we first met, you had mentioned you had a 14-year-old son, and he's now almost 16. So congratulations for weathering that and COVID. I've got 3 kids. I am not looking forward to those years. But how has your relationship with him been affected by, at first, all your symptoms and now where you are today?
I mean, before I couldn't really do anything, period. So all of my relationships have grown a lot stronger. I hear from people, that saw me then and see me now, and they tell me I'm glowing and that I look so much better and that I seem really happy. And
All right. Well, I would echo those sentiments. I remember when we first met, you had the kind of typical, like very fatigued, I'm in a lot of pain, I'm just trying to get through the day kind of look through your, when I looked at you now, it's just a big smile. The eyes are wide open, and it's, the sun is shining even in the background. So looks like things are, have all gone in the right direction. I want to give you the last word if you have anything else that you want to say. And otherwise, I will thank you for taking the time to tell us your story.
I'm just really grateful that I had the opportunity to get my life back. So I want to thank you for that.
Well, I really appreciate it. I love hearing stories like that. So again, thank you for your time, and we'll chat again soon for some additional longer term follow-up in the next few months. Okay.
Okay, sounds good.
All right. Take care.
Thank you.